Great. Hello, everyone. My name's Melinda St. Louis, and I am the Director of Public Citizens Medicare for All campaign. I'm really pleased to welcome you to this month's Medicare for All Resolutions Coalition webinar. Really, few of us could have imagined that 5.5 months into this pandemic, we would still be facing this much uncertainty, with now more than 180,000 confirmed COVID-related deaths, tens of millions of unemployed, parents like me staring down a school year with impossible choices to keep our families safe and sane. And yet, here we are. And we are continuing to come together in spaces like this and many others to build community, to turn our outrage and exhaustion of too many tragic stories into strategic action to build the case and the power we need to win Medicare for All, because we know that too much is at stake not to. We know that there have been some political conventions in the past few days. There may be one even happening right now. I'm not sure. And much is at stake in the election. But our focus here tonight is not the election. It's about building our ground game for Medicare for All, because we know that corporations that benefit from the status quo will do all they can. They will spend all they can, no matter who wins the White House or any House or Senate seat, to fight change. And so that's why we're organizing in communities, large and small, to educate our neighbors and local officials and to win resolutions in support of Medicare for All. And we've had some victories over the past few weeks. Maplewood, New Jersey, Kalamazoo, Michigan, and St. Paul, Minnesota are recent cities that have passed resolutions in support of Medicare for All. Tonight, we have a very exciting panel of speakers, and beginning with one of our key champions in Congress, Representative Joe Neguse from Colorado, a vice chair of the Medicare for All Caucus in the House, to hear the strategy of how progressives in Congress are responding to the COVID crisis and using it to build the case for Medicare for All. And we'll hear from health providers, Dr. Susan Rogers, the president-elect of Physicians for National Health Program, and from Rita Valenti, a nurse on the board of Healthcare Now. And we'll hear about creative and powerful actions during the pandemic from our partners at Center for Popular Democracy and National Nurses United, and learn from local organizing successes and efforts in Kalamazoo and in Washington, D.C. So please share your questions and comments in the chat, or you can email us if you've called in at medicareforall@citizen.org if you're joining by phone, and our panelists will try to answer them in the chat, and if we don't get to your questions, we will definitely follow up with you. So let's jump in. I'm really honored to welcome Congressman Joe Neguse from Colorado's 2nd Congressional District. Representative Neguse was new to Congress this term, but wasted no time in taking leadership on progressive issues, including becoming the vice chair of Medicare for All Caucus. Representative Neguse, thank you so much for joining us tonight and sharing your insights with us.
Well, good evening. Now, thank you, Melinda, for the very kind words. Thanks for including me in this wonderful event. It's good to see all of you all, to see some old friends and to meet some new friends as well. I hope you all are staying safe and healthy, of course, during these very tumultuous and turbulent times. Here in Colorado, for those who might be on the line who are constituents of mine in Boulder and Fort Collins in our Central Mountain communities, good evening. And of course, to everyone who's dealing with the multiple natural disasters that are really, raging across different parts of our country, the wildfires in Colorado, in California, and then of course the hurricane down south. Obviously another existential issue that we all have to address in climate change, but we'll save that for the next session that Public Citizen hosts. Today, we're here to talk about an issue that is near and dear to my heart. I know an issue that's near and dear to yours, which is the fight for universal health care, and in my view, the need to make Medicare for All a reality in the United States of America. And as Melinda mentioned early on in my tenure in the Congress, I'm a freshman member, but I was very eager to join the Medicare for All Caucus and was grateful to be asked by Pramila Jayapal, of course, our fearless leader as the chair, to serve as one of the vice chairs of the caucus and to help move the legislation through the House. And it's been a big legislative session, as you know, Melinda, and as many of those who are on tonight's call, I'm sure, are aware. There's been some progress in the House. We went from somewhere between 40 to 50 co-sponsors to literally over half of the Democratic caucus in the span of 2 years. That doesn't happen by accident. That happens because folks like yourselves are on the ground level, at the grassroots level, doing the work every day, day in, day out, convincing local leaders, right, in city councils and towns across America, some of which were mentioned by Melinda just a few minutes ago, to raise their voices, which in turn lifts their voices in support of legislation all the way to the halls of the United States Congress. We've had multiple substantive legislative hearings on the legislation, again, a first in the history of the Congress. And I think that momentum really is on our side. And of course, the stakes couldn't be higher. As you all know, the real vulnerabilities in our healthcare system have been really laid bare, right, and exposed by virtue of the COVID-19 public health emergency. When you think about where we are, over 175,000 Americans dead, just loved ones lost across the country. You think about the millions upon millions who are unemployed, the worst contraction in GDP literally since the Great Depression, right? Times are very, very tough right now for a lot of families and neighbors and fellow community members of ours, folks who are struggling to make ends meet. And if that weren't enough, right, they are losing their employment. And in many cases, as we all know, their health care is tied to their employment, and they are left struggling to try to find a way to purchase insurance on the private market, which it just, as many of you all can attest, is completely unreasonable from a pricing perspective, and ultimately leaves so many of our fellow Americans out in the cold, right? No American should go bankrupt if, God forbid, a loved one gets sick. And yet today, that is too often the case. So we've got to do everything we can to make Medicare for All a reality. We're going to continue pushing, me and many of my colleagues in the Congress, to fight to make this happen in the United States Congress. And I am optimistic about our ability to do so, because, as I said, I think more and more Americans, as they deal with the inefficient and the expensive system as crafted today, they recognize that there's a better path, right? A path that ultimately ensures that every child, every man, every woman in our country is able to get the basic level of care that they need, right? Consistent with the recognition that I think we all understand, which is that ultimately healthcare is a fundamental human right, and we ought to be willing to fight for it. So again, I thank you for the work that you've done. I thank you for the work that I know you're going to do over the coming days, weeks, months. I hope that I get to speak to you next time around in person as opposed to virtually, as we continue to make inroads against this terrible pandemic. But again, I thank you for all that you're doing. Please keep it up. Stay safe, stay healthy, and above all, please stay hopeful. Thanks again.
Thank you so much, Congressman. We're so grateful for your leadership, and like I said, we're planning to build the ground game to support you in Congress. So please continue fighting, and we're here with you. Thank you so much for taking the time. We appreciate it. Thank you. Now I'm really honored to welcome one of our key partners in this coalition, the Center for Popular Democracy. Vinay Krishnan is the national field organizer for CPD, and they've been doing really important work organizing families of people who have died from COVID. They're in a recent March for the Dead, Fight for the Living. And Vinay, we'd love to hear a report from you all from the front lines.
Sure. Yeah, thank you for having me. Let me know if you can't hear me or anything like that. But yeah, I thought that was just a fantastic intro from the Congressman. I think all of the goals that he laid out is what we're trying to do with this campaign. And sorry, is my connection to Spike? Was that for me?
Yeah, you are cutting out.
Let me switch rooms.
If you'd like, we could come back to you, or if you want to just try one more time.
Any better in here?
I think so.
All right, give me a thumbs down if you know.
Yeah, no, I think it's not working. Why don't we move on, and then we'll try you in a couple of minutes, if that's okay. So while Vinay hopefully can make the connection work a little bit better, I'm honored to welcome Dr. Susan Rogers, who's the president-elect of Physicians for a National Health Program, one of the key partners in this Medicare for All resolutions effort. She's recently retired, but a volunteer attending hospital as an internist at Cook County Hospital in Illinois. She previously was the co-director of medical student programs at the Department of Medicine, and she's assistant professor of medicine at Rush University and assistant professor of medicine at Rosalind Franklin University. So welcome, Dr. Rogers. We're really grateful to hear from you today.
Well, thank you so much for inviting me to be on this panel. I'm really happy, to be here and join everyone today. I had spent almost my entire career as a PCP and hospital at Stroger Hospital in Cook County, taking care of patients who actually often had few, if any, choices of where to go for their health care. I saw firsthand the unfairness of our current healthcare system when I became a medical student. I saw patients wait until they could wait no longer because of the financial barriers that deterred their access to healthcare. We have a system that is driven by profit rather than need, and the racial inequities that have been so obvious to me since I became a physician have so long been ignored by the public policies that continue to endorse and support a private health insurance-based system that is coupled to employment. COVID-19 has now laid bare these inequities, and we cannot continue blaming poor people for their being poor. We can't continue blaming poor people for their illnesses because of their choices, or rather their lack of good choices. The Black poverty rate in this country is about 2.5 times that of whites, with 1 in 5 Black people living below the federal poverty level. Now keep in mind that the federal poverty level was never meant to be a level that could sustain a family indefinitely. It was defined as the amount of money that someone could live on for a month in an emergency. It was not meant for people to live indefinitely on. So it shouldn't be a surprise that Black Americans, who make up only 12.5% of the population here, account for over 22% of the COVID deaths. Now that data that was from late May, so it may be a little different, but the point is that we're still much, much more affected than we should be for our percent of the population. Now, historically, the unemployment rate for Blacks has always been twice as high as the unemployment for whites, leaving Black people in this country economically insecure even before the pandemic. And our current employment system has not kept up with the changing demographics of the labor force here. We no longer have a traditional work week in which most full-time workers put in 40-hour weeks, but instead we have a system that favors part-time arrangements and independent contractors. And such an arrangement now accounts for about 40% of jobs, of all jobs, and this is expected to increase as the economy emerges after the pandemic. And despite the assistance programs, the CARES Act and the PPP that was orchestrated by Congress, the outdated vision of employment in most states continues to put Black, Hispanic, and female workers at a disadvantage. So when people of color are employed, they often do not have benefits that include health insurance or paid sick leave. They are more likely to be frontline workers, which we know are workers that are grossly underpaid, cannot work from home, yet they have the essential jobs that place them and their families at greater risk of becoming infected with COVID. Now, Black women are more likely than white women too to be single heads of households, which makes Black families even more vulnerable if she were to be unemployed or sick. So people of color have higher rates of underlying chronic illnesses, which increase the risk of hospitalization and death from COVID. Blacks are 3 times as likely to live in poverty as whites, and in communities that do not have grocery stores, pharmacies, healthcare access, transportation, and many are geographically very close to environments with unsafe air, water, or other conditions. People of color often live in multi-generational housing, which without adequate space to socially distance or quarantine. And 25% of poor Blacks live in neighborhoods of what we call concentrated poverty. That's where at least 30 to 40% of the people in that neighborhood live below the federal poverty line. 25% of Blacks, however, in this country, only 5% of poor whites live in concentrated poverty. So Black poverty is not the same as white poverty because of the entrenched segregation that this country has sustained and promoted. So the disproportionate effects of this pandemic, they aren't an accident and they should not be looked at as unexpected. We have a system that does not prioritize people of color even during normal times. Should we be surprised that when it doesn't support them during a time when their needs are greatest? The inequities that we see in healthcare are the results of a fragmented health system driven by profit rather than need. The structural racism in this country has created, condoned, and sustained segregation with its unequal access to governmental policies and services that enable growth and success of only some of its residents here. This has to be deconstructed and replaced with a system of fairness and equity. Healthcare is a necessary part of what is needed to achieve social justice. We need Medicare for all to make sure that healthcare is in no way linked to employment, that there are no financial barriers to deter care for anyone, and that healthcare access is available to all who need it when they need it. There should be no need for profit-driven private health insurance that encourages resources to be placed in areas that they can make money rather than in areas where they can make people healthier. It is to our benefit that we're all healthy. And this pandemic has clearly shown that we all should have access to health care, not just for COVID, but for all our healthcare needs. We need a system that is publicly and progressively funded, but privately delivered, one that is not tied to employment or an individual's personal health, one that provides access and care to all communities. We need Medicare for all.
Thank you so much, Dr. Rogers. We're so grateful for, it's absolutely critical that our movement needs to continue to center racial justice in our work and to connect with communities of color that have been fighting for this for years. And so we're really committed to doing that, and we want to thank you for bringing that really important perspective right now to our discussion. And there was definitely, if you want to check the chat, there were definitely a lot of interesting conversation about that. So thank you so much for joining us. Now, Vinay, would you like to try again to see, again, Vinay from Center for Popular Democracy? Okay, well, it seems like we're having some technical difficulties with Vinay, but so we will come back if possible. But I do encourage everyone to check out March for the Dead, Fight for the Living, with that Center for Popular Democracy has organized over the past few days and weeks with COVID families. Next, I would like to invite Rita Valenti, who is a nurse from Georgia, who serves on the board of our coalition partner Healthcare Now, and also part of the Southern Workers Assembly. And she's been working closely with community organizations in the South who are struggling through the pandemic. And I think it's really important to hear a perspective from the South. So welcome, Rita.
Thank you, Melinda. Thank you so much, Dr. Rogers. Really, really appreciate that. And Congressman Neguse, thank you so much. And thank you for having me on the call. it's important to recognize that Saturday is the 15th anniversary of Hurricane Katrina, which was a nodal point for all of us in the South as we watched people who were the most dispossessed being abandoned by our government. And we in the South, the Southern Movement Assembly, the Southern Workers Assembly, and another, the Gulf Coast Center for Law and Poverty, are continuing to build and recognize the impact that climate change is having, particularly disproportionately on people of color, Black people, Indigenous people, immigrants, and Latinx people. Indeed, after Katrina, Charity Hospital, one of our premier public hospitals, was closed. I also happen to be a registered nurse of 30 years, very proudly, and worked at Grady Hospital, which is a little bit like the Cook County Hospital of the South, Dr. Rogers. We have a governor here who 2 days after George Floyd was killed, Rayshard Brooks, a Black man in Georgia, was murdered down by the police, and our governor proudly proclaimed, "We have your backs." And then the legislature was called into special session, and though it was the first time that the state of Georgia passed a hate crimes bill, corresponding to that was HB 838, which gave the police special protections too. So we're fighting on many, many fronts here. Our governor, who was the Secretary of State and continued to hold that office while he was campaigning for the governorship, succeeded in purging 1.5 million Georgians from the voting rolls, again, disproportionately people of color, and many of us feel that that election was essentially stolen. 6 of the 10 southern states that have not expanded Medicaid also have enacted restricted voting rights, well, not voting rights, restrictive voting suppression measures after the Voting Rights Act was essentially gutted. So here we are in the South, where the figures that Dr. Rogers was talking about are exponentially expanded. We have no Medicaid expansion in most southern states, with the exception of Louisiana and Arkansas. 92% of the people that fall in that coverage gap are in southern states. We have a higher rate in the South of uninsured, roughly twice as high. Almost every southern state's healthcare metrics going into the pandemic was worse. Georgia, Mississippi, Arkansas, Louisiana, all of these states, and all along the southern rural Black Belt, which is known as the stroke belt, we have a disproportionate number of people, roughly 30% of all preventable deaths occur in 8 southeastern states. These were some of the logistics, some of the demographics going into the pandemic. And as you know, we're faring a lot worse for it. I wanted to talk a little bit too about what's happening in the rural South with the closure of rural hospitals. 60%, well, I think there's been about 140 rural hospitals that have been closed around the country. 60% of those rural hospitals are in the South. In Georgia, we have 69 counties with no OBGYN. We have another 90 closures of federal healthcare clinics that were critical in southern states, particularly in Florida, Texas, and Mississippi. And interestingly enough, those federally funded clinics also have their roots, their origins in the South, with the Mississippi Freedom Democratic Party and the Medical Committee for Human Rights creating the first such clinic in Mississippi, the Mississippi Mound Bayou Clinic, which was a partnership between the people of Mississippi, Tufts, and the federal government, the first one created in the country. We also recognize that the problem isn't race, the problem is racism. And racism creates this generational trauma, which exercises exorbitant amount of stress on people of color in the South, which leads to inflammation, which in turn creates a higher rate of chronic illnesses, be it stroke, diabetes, heart disease, and of course, essential hypertension. Coming into the pandemic, and I think we have to recognize this from a structural point of view, the rural Black Belt of the South is the old plantation area, and it's called the Black Belt because the soil there was so very rich. And people that are living there, many of them are elderly and are ancestors of the very people who were farming cotton back before the Civil War, and even for a long time after the Civil War with sharecropping. And that slavery provided the foundation, really the economic foundation for global capitalism in the world today. And that's the problem. That capitalism created the problem of this pandemic in the way that it's responded to it, and it can't solve the problem effectively. And we've seen that particularly with this state rights doctrine that is so prevalent in the South. The federal government essentially punted responsibility to the states. The states, at least the states in the South, punted that responsibility in turn to the counties. The counties punted the responsibility to the cities, and the cities in turn punted that responsibility to the hospitals. And now it's being punted to school superintendents as schools are opening, and we have an exponential rise in children that are testing positive for COVID-19. 21,000 kids under the age of 18 have tested positive for COVID-19 in Georgia. And in fact, the deaths from COVID-19 are much higher in the South for people under 70 years old. And some people in the medical community call that weathering. I just call it the impact of the intertwining of white supremacy and the profit motive in capitalism. Because we have such disproportional illness in the South from these historic conditions, they're not the kind of patient that hospitals want to take on. They cost too much money. There are too many multiple illnesses. So we have a healthcare system that is essentially running in the interest of its own interest, its own securing its own future. We also see, as a nurse, this whole question of PPE, personal protective equipment, is very difficult to get in the South. Indeed, so is testing difficult to get in the South. The N95 masks went from 38 cents a piece to over $7 a piece. I mean, what kind of society do we live in that actually allows this to happen? Our governor has said he sued the city of Atlanta when our mayor, Keisha Lance Bottoms, instituted a mandate for the people in the city to be wearing masks. And the governor sued the city of Atlanta in response to that. He ended up having to back down, but still, Georgia is a state that does not mandate masks, and is a state who uses its resources in the most militaristic and policing way. While we saw in Portland, number 95 calling in brown shirts, they didn't have to do that in Georgia during the Black Lives Matter demonstration because the governor had already called in the National Guard. Shame on him, and shame on our state legislature, which has just cut $91 million from mental health, substance abuse, and developmental disability services. Shame on our government that just cut $8 million from public health resources. You know, we talk about a dual pandemic, and that dual pandemic is a pandemic of violence. And it's two branches from the same tree. And we experience that disproportionately in the South, and in particular, Black people and people of color. I wanted to also share, I mentioned before the rural hospital closings. The most recent one is Southwest Regional Medical Center, which is in the Georgia Black Belt in Randolph County, which is a majority Black county that has the highest rate per capita of infections of COVID-19. and also had been designated as a critical access hospital. Now, the closest hospital to people living in that county is more than 30 miles away. And this continues to roll out in the South. I wanted to, I guess I'm about running out of time, so I wanted to talk about, just for a minute, why Medicare for All is so critically important in the South. It provides the financial basis to begin to address these healthcare disparities. It's not going to solve all of that, but it will have a tremendous impact by creating at least a level playing field where everybody in, nobody out, documented or not. And HB 1384, Congresswoman Jayapal's bill, is really excellent because it also looks to use that money and place it in areas that have been disproportionately disenfranchised in terms of both the vote and in terms of healthcare as well. We're very excited here. We've got a Southern Movement Assembly that's planning for 100 days of action on J1. We have the Southern Workers Assembly that is mounting a campaign, Safe Jobs, Save Lives. I think it's important, just one more thing, you know, I gotta laugh when people say essential workers, which by the way, were designated by Homeland Security. Certainly, for Southern workers, the job is essential, right? Because there's very little support and very little backup in savings that people would actually have. We need coming out of this pandemic to have a new system. We have to get Medicare for All passed, and we have to start looking at what kind of public health infrastructure we really need. You can't tell people to stay home for 2 weeks in quarantine if they test positive, if they have no way to get food, to have their health care checked in, to have their housing secured, their bills paid. This is the kind of public health care infrastructure we need to look for. And certainly the immediate expansion of Medicaid is a step. The passage of Medicare for All is absolutely critical. And then we can build for the healthcare system we really need. So thank you so much. Thank you. Thank you from the South. We love y'all. And oh, one more thing, shout out to the nurses in Asheville, North Carolina, who are organizing a union at Mission Hospital, which was bought by the ACA, that's making profits hand over fist. So get everybody around the country to support those Mission nurses in Asheville, North Carolina, and our nurses all over. Thank you so much.
Thank you so much, Rita. As you'll see in the chat, people are very enthusiastic and a lot of interest in the topic. And I think there's a lot there for us to digest and to really commit ourselves to as a movement to support the South and to really bring all of these issues together, which I think is absolutely critical. So thank you so much. I want to just mention that Vinay, unfortunately, as you folks may have seen in the chat with Center for Popular Democracy, there was a storm where he was, and that's why it knocked out his Wi-Fi. What he did put in the chat some information about the recent action that they did, and I will just mention really quickly that folks should check that out. It was a Google Doc. I'll put that in again into the chat. But Center for Popular Democracy, as a key partner, has been mobilizing with families of people who have died from COVID. And on Friday, August 21st, just last Friday, they had a March for the Dead that happened across the Brooklyn Bridge, a candlelight vigil that got a lot of press attention. And the goal is to spark actions and activities, and it happened in other places in Arkansas, in Wisconsin, Maine, San Francisco, and Los Angeles. And the plan was to launch a COVID Families campaign, which will organize families of loss to seek justice in the wake of the tragedy. In many ways, and so seeking reparations for their losses, helping to transform the healthcare system under a new administration. And so I encourage folks to definitely check that out. Now I'd like to turn it over to my colleague, Brittany Shannahan at Public Citizen, who's been supporting local leaders all over the country, to introduce our next speakers. Brittany?
Hi, sorry, I'm having some issues as well here.
Oh, okay. Should I just keep going then? Okay. I guess we're having some internet problems. As we know, there are storms, and I think we also need to all just keep in our hearts the folks in Louisiana right now as well that are facing Hurricane Laura and people in California facing fires. This is just really a really challenging time for so many. I would like to welcome now Parker James, who is with Southwest Michigan DSA. They've been organizing for a long time and had a recent victory in Kalamazoo County, Michigan. So Parker, tell us about the organizing work you've been doing.
Good evening, everyone. It's so nice to be with you all. So yes, my name is Parker James, co-chair of the Southwest Michigan Democratic Socialists of America, or DSA. DSA has been a partner in the Medicare for All movement. And so we had a local work group through our chapter in town in Kalamazoo, Michigan. And we were canvassing residents in Kalamazoo, across Southwest Michigan, and finding that, so many of our neighbors understood that our for-profit capitalist system of healthcare and coverage was really failing us, right? So we didn't have any trouble finding support, and we wanted to figure out what's a good goal to work towards. The resolution campaign was, a really great organizing tool to build our ground game. Melinda, as you said, I like that, to build our ground game in support of Medicare for All. So we developed a petition, in support of a county resolution and a city resolution for Kalamazoo. We began canvassing with that petition at local community events, just outside of the library, in different neighborhoods, door to door, prior to the pandemic. We also held events like the screening of the movie Fix It, which I hope many of you are familiar with on the call. Those events were really great. We had postcard signings, and then COVID hit, and we really weren't sure, what to do next. But we adjusted. We moved things online. So we had a webinar with a doctor who was a member of Physicians for a National Health Plan come and speak around why Medicare for All is so important. We generated an online petition to support the petitions that we had physical copies of. And through this, we were able to gather over 500 petition signatures and really just build our ground game, right? And so we felt like we were ready to approach the commission. We approached the Kalamazoo County Commission as a work group. I want to give a shout out to Bill Farmer, who's a fellow organizer with our chapter and is on the call today. Bill made personal calls to our county commissioners to talk to them about the topic. Other DSA members also called and helped answer questions. We sent a package of materials around how are we going to pay for it, what the bills cover, how it's connected to racism in healthcare. So really just trying to give all the information we could. Through this, we also made the connection to the pandemic, people losing their health coverage, the lack of testing, and just coordinated efforts that we had going on. Kalamazoo County passed a resolution declaring racism as a public health crisis. We immediately sent a letter to the county commission saying, we're so glad that you passed this resolution. The resolution says that you should take action in support of legislation that would address racial disparities in healthcare. And here is one way you can do it: by passing a Medicare for All resolution and being advocates of this legislation in our communities. And so that really got the ball rolling. We did have 2 county commissioners really be the champions for us. One was a veteran, was able to speak to his experience in the VA healthcare system. And the other was the woman who introduced the racism as a public health crisis resolution. So together, we, really just built a strong coalition. We also made presentations to groups outside of, our DSA chapter. We presented to anti-racist interfaith groups and also anti-war groups, building a coalition. And so we were just ready when it was heard at in our public meetings. We were able to get many speakers to call in and voice their support, and our resolution passed with flying colors, which we were not necessarily anticipating when we first started talking to commissioners. So that's a little bit about, what we worked on in Kalamazoo. I understand that this might have been a longer process than some other cities and towns and things are going through, but we were able to build a really strong network that we're now continuing to move forward. People are really fired up and want to do more on this issue. So that's a little bit about what we did in Kalamazoo, and happy to connect and talk to anybody if they're interested in hearing more. So thanks.
Thank you so much, Parker. It's really inspiring, and I think that that this is a lesson that that many folks around the country can follow. And so thanks to DSA, to all of you for all that you did. And we definitely will connect folks up with you. And I did post in the chat for folks a copy of that resolution. We have it on our website on our map. And we will paste that in and encourage you to sign up your community as well, if it's not already on there. So next, I'd like to welcome Max Cotterill from National Nurses United, one of our biggest and most important partners in the work for Medicare for All and Medicare for All resolutions. The NNU recently hosted a National Day of Action this past Saturday with creative social distant actions that could be a really great example to augment local advocacy. So I want to welcome Max to share a little bit about that Day of Action.
Thanks, Melinda, and thank you, Public Citizen, for putting together this really jam-packed webinar with lots of amazing people from across the movement. It's always really cool to kind of see all the different layers on top of each other. Before I jump in, I know also our Minnesota Nurses Association also joined this resolutions fight recently. They got a resolution passed in support of Medicare for All in the city of St. Paul, which we were really excited about. So. But yes, my name is Max. I am an organizer on the campaign to win Medicare for All at National Nurses United, which is the country's largest union of bedside nurses. I also want to thank Rita for just shouting out the nurses at Asheville. That is, we're feeling good about that. But just for those of you who don't know, there's several thousand nurses who are fighting to form a union at Mission Health in Asheville, which is part of HCA, which is one of the country's largest healthcare corporations. Who is somehow unable to deliver their healthcare workers PPE while posting a record $1 billion profit in the first quarter of this year. So, I think we're very excited about that union drive and continuing to organize the South. So yeah, like Melinda was just saying, many of you probably know, I see lots of familiar names in the chat. We hosted a National Medicare for All Day of Action this past Saturday, which was calling on supporters from around the country to come together during the most unprecedented public health crisis of our lifetimes, in which up to 27 million people have lost their employer-sponsored healthcare. And certainly, speakers on this call have talked about some of the just egregious racial health disparities that are just becoming more and more exacerbated by this crisis. So our hope is that, both the public and, elected officials are starting to really see and feel some of the broad support for comprehensive healthcare reform, right? And despite the pandemic still, in full swing and, with natural disasters around the country, with fires burning across the West, certainly here in California where I am, Saturday ended up being what we thought was a pretty big success. We had over 100 volunteer organized actions in 21 states and the District of Columbia. We had somewhere over 1,000 people come out to these socially distanced actions. And because of this continued spread of COVID, we've had to kind of pivot a little bit and pick some different tactics that are able to be done both outside, but also while socially distancing. So we work really closely with our internal health and safety department to make sure that we had really safe guidelines for all of these events, which spanned from banner drops to sign holding actions to car caravans, lots of different kind of creative things around the country. So again, thank you everybody on this webinar who took part in that. At the same time, we've also been working with Medicare for All supporters all around the country to set up meetings and continue to pressure particularly members of the US House who have not co-sponsored Medicare for All during this August recess that's been going on. And so to date, over the last month, supporters have met with about 20 members of Congress, all in districts of members who have not yet co-sponsored Medicare for All. So that's kind of simultaneously happening at the same time. And I just want to pause for a second and kind of zoom out for a second. I really think that there's, a lot of irony that, the time in which we need to kind of all be there for each other the most, this time when millions of people are getting kicked off of their health insurance is also the same time that we have to be really careful to not spread COVID, to, keep our distance in person, largely to not, work with each other in person indoors. It's kind of ironic. And this is definitely something that's kind of changed the way in which we must organize. But I also know that, that's true, but we also know that this crisis cannot be allowed to slow down this movement. I think all of you know, I don't need to say it again, but I will, every day that passes, untold amounts of families are losing their healthcare. And I think we're all on this call because we know that it's enough is enough, right? This has gone on far enough. It does not need to be this way. And so what I'm really here to say is that another world is possible if we can kind of band together and fight for it. So I think to kind of conclude here, my ask of all of you today is to stay involved if you are involved. If you're not involved, get involved. There are so many different ways to do so. You can start or join a campaign to get a local resolution passed. You can work to meet with your member of Congress. You can demand that they take action. You can work with NNU to have conversations with your friends and family to move them to take action. The last thing that I'd like to finish with is just that we know that the public is with us, right? There are millions of people out there who support Medicare for All. We see this in the polling over and over and over again. And yet we're not yet able to pass it, right? And so what that tells me is that our task is very clear. Our task is that we have to reach out to these people, to these millions of people who support this, to activate them, to substantially grow our movement, bring those people in who have never taken action before, and ultimately make it politically untenable for you to be an elected official in this country and to not support guaranteeing healthcare through Medicare for All. That's really our job when you kind of boil it down. So again, I want to just thank everybody for all your work. Thank you, Public Citizen, again for inviting me. And I can't wait to get to work with all of you. I'll pop some links in the chat on how you can get involved. But again, thanks everybody.
Thank you so much, Max. We are so always so grateful to the work of NNU and all of the amazing organizing that's happening in communities around the country. So thank you so much. Now I'm really thrilled to invite Terrence James, a TJ from Spaces in Action, which is an affiliate of Center for Popular Democracy in my hometown in Washington, DC. And we've been working together focusing on the DC City Council. So welcome, TJ.
Thank you. Thank you. Hey, everyone. It's TJ here, Outreach Coordinator with Spaces in Action. And yes, we are located right in DC. Spaces in Action is a grassroots organization that works with low-income community residents within DC and Maryland who are impacted by social, health, and economic injustice. Over the past few months, we have seen just how unfair and scary our health system can really be. The time is now for Medicare for All. The Medicare for All Act of 2019 improves and expands the Medicare program so that every person living in the United States has guaranteed access to healthcare with comprehensive benefits. It guarantees comprehensive and quality care for all without copays, deductibles, or out-of-pocket costs. As we continue to feel the impact of COVID-19, we should not fear a bill over the health and wellness. No one needs to be forced into poverty due to a health crisis. Did you know that 59% of the 28 million are uninsured people of color? Dr. Sanji, also known as Dr. America in the DMV, joins the Spaces in Action's Medicare for All cause before the pandemic and since its began. Over the past month, our goal has been to apply pressure to the DC Council to get them to begin a discussion that we want to lead to the passage of DC Medicare for All resolution. SIA members have been calling to request meetings with their council members. The COVID-19 pandemic has really exposed how much this country and DC must get the support of health from, The COVID-19 pandemic has really exposed how much this country and DC must support the health of its people and all of its people. If white people are affected by this, then that means that Black and brown people will get hit even harder, and Black people probably the hardest. This is why we would like to set up by Zoom or by phone a meeting with the city council so we can talk about the important issues. We have members with health stories. They want their stories heard and their solutions implemented. The council members need to see our faces and feel our expressions. They need to understand how real people are being impacted by their actions or inactions. We have members who are survivors of COVID-19, who have lost family members due to it, and many who are suffering financially because they have to choose between food or healthcare costs, such as prescription drugs. In June, we held an action outside of Health and Human Services. We tried to deliver letters from across the country calling for Medicare for All. Secretary Azir did not receive us. He was in the building, but he was not trying to come outside. We held a speak out right in front of the Health and Human Services. We told stories and we read the letters. That were from around the country. We also had go-go music in support of our efforts of DC's culture. We used social distancing and offered hand sanitizer, free fresh bags of produce, and we provided branded masks. And our masks read Medicare for All, Medicines for All, and People Over Profit. That's my favorite one right there. Tonight, let's focus on DC and the council. They need to be our champions for the families living in DC. Let's continue to keep the pressure up on them and call our offices to ask for meetings. The movement to get Medicare for All resolution passed in cities is spreading from Maplewood, New Jersey to cities in Michigan. Congratulations once again. This success began before the pandemic and is even more important during the pandemic. We can organize, we can win Medicare for All resolution now. During the pandemic, it is possible, it is necessary. Spaces in Action wants to keep up that momentum. DC and the council need to be our champions if it is possible. The time is now. DC needs to pass Medicare for All resolution. And thank you again, Melinda, for allowing me to speak today.
Thank you so much, TJ. We're thrilled to be working with Spaces and all of the CPD affiliates around the country, and can't wait till we manage to pass the resolution through the council. But there's also been all this really great base building work in all of the different neighborhoods in DC, which I think is also just a really a great example for folks to be following around the country. So thank you so much. And now I'd like to turn it over before we close to our wonderful summer intern, Rita Asselbaye, who has been working with Public Citizen this summer. And I wanted to give him a chance to share a little bit about some next steps. So, Reed.
All right. Hi, everyone. Good evening. My name's Reed, and this summer I've had the privilege of interning for Public Citizen through the Medicare for All Resolutions campaign led by Melinda and Brittany. It's really nice to be in conversation with you all. Just to introduce myself, I'm about to enter my senior year at UC Santa Cruz, so hello to all my California folks. Over the summer, I've had the opportunity to speak with a diverse array of organizers, activists, and community members, including many of you on this call right now. So I've been the one constantly texting you all, reminding you to attend these webinars, or the one calling to ask if you're interested in supporting a local resolution. Speaking with activists from all around the country has been simply inspiring. You all bring so much valuable knowledge and insight to this movement, and despite everything that's currently unfolding, seeing how committed you all are to progressive change makes me feel a lot more hopeful about our collective future. I'm living in Northern California, and right now we're experiencing multiple crises converging in one critical moment. And navigating this internship amid an ongoing pandemic, unprecedented heat waves, and record-breaking fires, one of which is burning just 5 miles from me, has cemented my position that things need to change in this country, and quickly. Medicare for All is merely one of those things that we need immediately. It's a priority that's particularly critical at this time. I joined this internship with an eager interest in Medicare for All's importance as a tool to advance racial justice and equity. This really resonates with me because of my background. My mom's family is from the Midwest, white and solidly middle class, but my dad's family, on the other hand, is made up of working class African immigrants. Growing up, my dad's side of the family demonstrated to me how this healthcare system disproportionately affects marginalized groups. 3 years ago, when my grandmother had a life-altering stroke, she was rushed to a hospital where she had only me and her French-speaking husband by her side. The hospital had no French-speaking doctors, only nurses, so I had to use my fragmented translations, I'm not very good at French, to relay the doctor's observations to my grandma's husband to provide him with a basic understanding of her condition. Then, my grandma was sent to a rehabilitation clinic. Though she wasn't remotely well enough to return home, after 1 month, my grandmother's health insurer actively pushed the rehab facility to release her because of the costs she had been incurring. She ultimately had to leave the US to France, where she is now, receiving ongoing medical care from her stroke 3 years ago. I really miss her, and it's just completely unacceptable and a great iteration of how people like my grandmother are impacted by this for-profit system. Our movement must reckon with the historical underinvestment in the health and well-being of non-white and immigrant groups in the United States. Furthermore, this summer, communities across the country have risen up to protest systems of racial injustice. This movement must center and uplift the voices that have been marginalized and silenced over generations. That means listening to and supporting Black, Indigenous, and POC leadership as people of color in our movement and investing time and money towards addressing their needs. Finally, I really wanted to thank you all for building out this movement and continuing to lay the groundwork for those who will take up this work after you, people like me. I want to see Medicare for All become a reality in this country so that my generation can shift our focus to other efforts that uproot corporate power. So here's some next steps for you all. If you haven't already signed up to organize or join a resolution effort in your community, you can go to medicareforallresolutions.org. They'll put the link in the chat, and click on Take Action in Your Town at the top of the page, or click on the link in the chat. We have a variety of resources in our toolkit that we provided to help you get started. And I know that Brittany and Melinda will be super excited to connect you with other activists in your area to help you organize the first meeting. I just really wanted to thank Brittany and Melinda again for this amazing experience, and I hope to connect with you all soon, not as an intern, but as a colleague and as a friend. All right, thanks everyone, and have a great evening.
Thank you so much, Reed. I just want to thank you for all the work that you've done this summer with us, and for the campaign, and for all that you've contributed, and to everyone here, all of the activists who make up this movement, because it's really all of us. We have some amazing experts in our movement, but then we are actually our own experts, right? We have our own stories, and we have the stories of our family, and that's why this is an issue that we can connect with everyone. And so I want to thank everyone for your participation tonight. All of our panelists, Congressman Neguse, it seems like it was a long time ago that we heard from him. And because we had so many amazing people here tonight taking time out of our busy schedules to share insights, and we're excited that the momentum continues to grow even during these challenging times. With the recent victories we heard about tonight and others, I just heard from Hawaii that they're moving quickly in Maui and elsewhere, so we're going to have more and more exciting reports coming up. So please sign up if you haven't already. If you're a seasoned an activist, if this is the first time, we have toolkits, we have all of the things that you need to be successful, and be in touch with us on how we can support you in your organizing. And please, we will be doing another webinar in a month. Keep an eye out for that. We'll share the recording for this, so share it with your friends and allies. And if you would like to give an update on an upcoming webinar, please let us know, or if you have ideas for us, we want to make these really useful to all of you. So thank you again so much. And it was wonderful to see the organizing that's happening among you in our chat. And that's exactly what we're trying to do here. So thank you again. And let's face this fall and organize like our lives depend on it, because they literally do. So take care, everyone.